Hello, my name is Hitomi Honda, and I am Disability Advisor of World Vision International. Firstly, my apologies for not being able to access the audio during the earlier presentation. And I thank you so much for the organizer to give me this opportunity to record the presentation and share with participants. Thank you, Dr. Skeen, for going ahead to do your presentation a little bit earlier. So today I would like to share how World Vision as a mainstream development organization is understanding disability and approaching to disability inclusion. And in the course, I'd like to share with you some challenges, opportunities, and some of the promising practices. Before we start with any disability work, we think that it is very important that we understand, meaning we as in development workers, as well as community people with and without disabilities, understand how we understand disability. And this is the conventional disability and the understanding. It is really about what is wrong with this person. Now, this is one way to understand disability, but for an organization such as us, because we are not disability or medical organization, we find that another way of understanding disability is more suitable. So this is a more holistic, I think, disability understanding. I found three areas. When I was working with this boy many years ago, I found that perhaps disability, we talk often about what is disability, and I think we mix all three of them. But I think it's important to separate the three and have more focused approach or solutions. First is impairment. This boy acquired polio when he was very small, so he had impairments caused by polio. But function-wise, he was really able to function. He was walking with his hands, and he was doing most of the things that majority of people can do. So I did not really find that he had so much functional limitations. Yet, there were barriers to participation that he was facing. For example, he was not allowed to go to community regular school, primary school. School was not welcoming him, saying that he is a person with disabilities. And so there are these social issues that people with disabilities are facing. And this is an area that World Vision is really trying to address in our development programs so that they can better be included in our programs development work. Barriers to participation can be attitudinal, environmental, systems, institutional, and I will just share with you very briefly in the next few slides. But World Vision is intentionally trying to separate social issues from impairment, individual conditions, so that we can have more fixed or focused solutions. So attitudinal barriers. This exists in society, and also if we are not careful, this can also prevent people with disabilities from accessing development programs as well. Very often we talk about stigma, negative attitude, and these are huge obstacles. One thing that I would like to emphasize, something that we often overlook is assumptions of non-disabled people for people with disabilities. Development workers are also guilty of this. We tend to decide that this is a person with disabilities who cannot see or who cannot walk, and therefore they cannot do certain work. We already have an opinion. We decide for them. And this assumption is also setting a huge barrier for people with disabilities to participate as well. And there's also systems, legal areas, or the way we program sometimes sets barriers as well. So these are areas that we need to be also very careful. And then lastly, environmental areas around the infrastructure, information, communication systems. Also has a lot of barriers for people with disabilities to participate. Now, this looks quite obvious for even non-disabled people as well. Again, we have to be very careful that because we understand that disability is a lived experience, and only people who experienced it really know what is a problem, what is presenting a problem, and also be able to offer a very good solutions. So including people with disabilities in DME, in programming, in discussions, it is very, very important. In fact, without it, we can't really do a good disability inclusive development work. Global situation, I think the previous presenters have touched it, so I'm not going to go over very carefully, but just want to let you know that there is a direct link between poverty, discrimination, and disability or impairment. Majority of people with disabilities live below poverty line. Many children with disabilities, majority of them, actually receive no education. Children with disabilities, girls and women with disabilities are much more likely to be victims of violence and physical, sexual, and emotional abuse compared to non-disabled people. 30% of children and youth living on the street have some kind of disabilities. And gender sensitivity is also very important as we address disability inclusion in development work. Now, approach towards disability inclusion, what we first of all try to aim is not so much directly to make impact on inclusion in community, but we want to include children, youth, and adults with disabilities in our development programs. We do a lot of different kinds of work. We do economic development, livelihood, community resilience. We do gender work, we do protection, child protection, we do HEA, humanitarian emergency assistance. We do, of course, education and health. We do agriculture support and so many other areas. And so by making sure that people with disabilities are fully and meaningfully participating in these programs, we hope that the impact will be a better and more inclusion in community. And with this, we take two approaches. One is special support for those people who are most vulnerable. There are no doubt that there are many people with disabilities who are very, very vulnerable, perhaps most vulnerable in community. So we do provide special support in this kind of case. But then at the same time, the very important approach, I think, is enabling our programs to have equitable access so that people with disabilities can be fully included. Without equitable access in programs, so in communities or in society, many people with disabilities will become most vulnerable. So some of the good, promising practices that I will be touching, sharing in this presentation will mainly look at this equitable access. We are trying to enable our programs to have more equitable access. So that is really an important focus that we are trying to emphasize in our organization. Now, that work, of course, starts with disability awareness, sensitizing our staff and community members with and without disabilities. We want to partner with DPOs, and especially community-based DPOs, disabled people's organizations. Again, they are the ones who have lived through these experiences of attitudinal barriers, infrastructure, communication barriers, systems, legal barriers. So we need to hear from them, and they can advise us what are issues, what are problems, and what may be solutions as well. On the other hand, we also find that working with faith-based leaders or faith-based organization provides a lot of great opportunities. It's very powerful. When we have imams or Christian leaders or Hindi priests or Buddhist priests really talking about disability is not about bad luck, and demystifying disability and trying to eradicate negative attitude of people without disabilities and people with disabilities as well. They can be a wonderful, powerful instrument in the community. So we work a lot with FBOs. Now, assessment is also a very important area. We don't really know much about situations of people with disabilities. At best, perhaps in past, we would go into community and then we would try to learn how many people with disabilities are living in this community, what kind of disabilities do they have. Now, this doesn't really tell us the whole picture. So we are trying to also learn about situations surrounding people with disabilities. Do these people go to school? Do they have an access to health centers or economic opportunities? What is preventing them to participate? So these community situations we find is very important to learn about. Representation of community people with disabilities, including women, children, and youth with disabilities, different types of disabilities, is very important. It's not just about men with disabilities being representing the community people with disabilities. Diversity is very, very important. Now, participation of, we would like as much as possible community-based DPOs in DME or programming is critical. This relates to representation so that they can support not just disability sensitization, but reviewing and analyzing what are participation barriers. We also find that it is important to disaggregate data. Very often, when we go into community development workers, not just us, but in general, I think globally, we go in and we do research. We don't disaggregate data enough, and this we need to really strengthen more. And also measuring progress and outcomes with indicators. These are also very important, not just making commitments, but what progress are we making, what impacts we are making. These needs to be measured and then inform programming. Also standardization, especially around facility designs. These are also important areas that actually not doing something for people with disabilities or especially for disability projects, but if we are building latrines in the community or at school, for example, it has to be a standard that it is accessible for everyone. And so that is what we have been doing, and we have still a long way to go, but we have been doing quite a bit and succeeding together with partner organizations. Now, I have been emphasizing about the importance of working with DPOs, especially community-based DPOs. When we go to the capital or big cities, there are many, perhaps, disabled people's organizations with great capacity, and that's great. But we find a huge gap between capital or big cities and rural and remote areas. DPOs may not have adequate capacity to support community inclusion or to work with us. And also, in many places, there are no disabled people's organizations or even self-help groups of people with disabilities. So in these cases, we try to work with local stakeholders to help establish community-based DPOs. And then we provide support for capacity building together with national level DPOs or sometimes international level DPOs as well, such as Disabled Peoples International, and then support community-based DPOs capacity building. We also take opportunities to collaborate with specialist organizations to support areas that we don't have expertise. For example, as you see in this picture, we collaborate with Operation Smile in Ethiopia so that children with disabilities who receive surgery for cleft palate can receive holistic support. So it's not just about surgery opportunities, which is being provided by specialist organizations such as Operation Smile, but how these children or adults actually get to big cities where surgeries are being provided. They need financial support. And so we work with communities to come up with financial support. They need somebody to accompany these people who receive surgery. So we make arrangements again together with community stakeholders. And so these are some really good collaborations that we are actually doing with other organizations as well. And then we do one of the other areas that we are really strengthening is advocacy by children and youth and adults too with disabilities at community level, national level, and international levels. Now, inclusion practice, I'm going to be focusing on just 3 areas: WASH, education, and savings groups, but it doesn't mean that other areas are less important. It is just as important, and we are seeing a lot of wonderful inclusion practice in the field. But I'd like to just focus in this presentation 3 areas. WASH. First of all, WASH, again, as I said, standardization of accessible WASH, both infrastructure and services. At school, home, or communities, if you are doing WASH in community or home, that is really one of the first things that we want to ensure. WASH, we find, has a big impact in other areas. WASH itself, in a way, is a cross-cutting theme. It impacts education, protection, health, self-esteem, because it's also about appearance. You look clean, you have good hygiene. So that affects self-esteem, and that affects social interaction, and that impacts social skills development of that person. And then in the long term, it also affects that person's economic activities as well. We found that in one case in Zambia, we learned of a man who left school 7 years ago because the school did not have accessible latrine, and he could just not use that dirty latrine at school, so he left school. 7 years later, he found that the school had a new latrine, accessible latrine, so he went back to school after 7 years. So this is a really promising thing. You make changes in WASH facilities, and it has an impact that can be seen in education. So WASH is a sector work, but at the same time, it is a cross-cutting and impacting in many areas. There are challenges. I used to think that WASH should be so easy to do disability inclusion, just change the blueprint and it should not be any problem. Now, I was very wrong. First of all, there is a low awareness in the community for people with and without disabilities about the impact of inaccessible, accessible WASH. So we have to start with awareness raising. And also, changing or bringing in, even if it's a good, accessible blueprint or design of a facility, for example, toilet, we can't just change it the way we like, because we work with government, and government does have their own approved designs of facilities, such as water points or latrines. So we have to negotiate, we have to work with local government. We can't just bring in, even if we believe that this is a good design, we can't just bring in and replace what the government is already doing. So it takes time. And also another thing is that perception and actual cost of accessible wash. People think that accessible wash is going to cost a lot more. And we are finding that it doesn't cost that much more if it is in programming, if it's designed right from the beginning. Another thing that we find is that the community people actually don't think that wash itself is a priority. And when an international organization comes to the community, we found that our partner agency told us that they actually expect something like economic support or education support is to be provided by international organizations. They never expect that we start talking about toilets. So again, awareness raising about the importance of wash. We have to start from there. There are many opportunities that we are finding. There are many experts organizations that we can work with, such as we have been working a lot with Messiah College, which has expertise on accessible wash using locally available resources. We also have an opportunity to work with Water Aid in some areas, Handicap International. So expertise coming from organizations, specialist organizations, is a great opportunity. Of course, it's not external expertise we want to just bring in, but also community people with disabilities. Once they understand that disability is a participation issue, they are really able to advise us what is not working, what should be working. So we consider working with community people with disabilities a great opportunity. Accessible wash is not just for people with disabilities. It is for pregnant women. It is also for people who are temporarily injured or older people. And once people start understanding how accessible wash benefits everyone, we find that very often people take ownership. And in some cases, they go ahead and start building their own latrines, accessible latrines, without waiting for World Vision's assistance to come to them. So this is really encouraging, we are finding. Now, inclusion practice around education. We do have inclusive education as our ultimate goal. It is important that children with and without disabilities are learning together under the same education system. This is very important, but very often, because of different reasons, where this is not possible, we are starting to support special education or starting to really look at inclusion in ECD, which we think provides a lot of potential for inclusive society, and also to prepare both children with and without disabilities, including them as early as possible in preschool ECD level, provides tremendous opportunity for kids with and without disabilities, their parents, teachers, and also has an impact on community attitude as well. We also use something like, for example, a children's club, making sure that kids with disabilities are participating in children's clubs. Sometimes we have children's clubs just for children with disabilities, where regular children's clubs are not yet ready to receive or welcoming yet to receive children with disabilities. Then we support children's clubs for children with disabilities. We have buddy systems in some communities where children with and without disabilities are paired up. And then when they go to school, as they commute to school or at school, they help each other. And this is also a good opportunity we hear from non-disabled children to raise their awareness about disability issues. So disability inclusion is not just good for kids with disabilities, but those without as well. Community assessment really great opportunities that we are finding is that when we conduct community assessment, community situations surrounding people with disabilities, together with local stakeholders such as local government or school teachers or community-based PTOs, they become really aware of situation, pressing needs of people with disabilities, and they become very supportive later on. So it's not just that World Vision goes into the community and we do community assessment and then share the findings with them. What is a lot more helpful is to actually do community assessment together with these stakeholders. It leads to future support. Training teachers is very important. Very often teachers, when they welcome children with disabilities, it opens doors, especially preschool, primary school. The capacity of teachers makes a huge difference. And not just capacity, but welcoming attitude is very, very important. Negative attitude, low expectations that teachers have or parents have of children with disabilities, the main challenge. And also something like transportation issues, inaccessible school infrastructure such as buildings, school buildings, and wash facilities is a huge issue. I think some opportunities that really great opportunities that we are finding is to work with local universities or Ministry of Education to provide, for example, how we do inclusive ECD. They have great expertise that we can really work with, and then they can come to community and provide, for example, trainings or assessment together with us, and that we are finding it really promising. Now, the next one, the last one, promising practice is savings groups. We find that very often community people this includes people with disabilities, are really requesting support around economic activities. And we find that savings groups is a great method to work with people who are very poor and people who do not have assets. There are three main areas or types of savings groups. One is including people with disabilities in regular savings groups. Another one is having a separate savings group within regular savings group project. And then the last one is to have a separate project of savings groups just for people with disabilities. Including people with disabilities in regular savings groups has its own, of course, advantages. It promotes community inclusion a lot faster, we think. But at the same time, it does have challenges if non-disabled community members are not welcoming people with disabilities in their group. This really sets a barrier. And in that case, we may start with separate savings groups just for people with disabilities. On the other hand, if we are working in rural or especially remote areas where there are not too many people with disabilities to join a savings group, then having a separate group just for people with disabilities may not work. So there are pros and cons for inclusion or having a separate savings group. Just like WASH or education, we find that negative attitude, including low expectations of people with disabilities, is a huge issue. So non-disabled people not even welcoming or not even allowing people with disabilities to come and join savings group training. This has happened in some cases. And so negative attitude, again, low expectations. This person with disability is coming into our savings group and probably not accountable, probably cannot do this or that. That kind of low expectation sets barriers for people with disabilities to join. So again, disability sensitization is very important. On the other hand, it is true that there are some people with disabilities is very low capacity understandably, if they did not go to school, if they didn't have opportunities to go to school, if they didn't have a good social network, and to have more accountability, for example. So there is an issue of lack of capacity for some people with disabilities. Self-confidence is also a challenge for youth, young adults, and adults with disabilities as well. And also we find that some people with disabilities are very weak or lack of family and social support as well. These are areas that need to strengthen, as well as transportation issues and accessibility issues are also a challenge. Opportunities, we find that we can also target parents with disabilities and parents without disabilities but having children with disabilities is really promising. We also find that targeting or having people with disabilities in savings groups, they are more sensitive to urgent or critical community situations, to, for example, vulnerable groups, other vulnerable groups. We find that saving groups members with disabilities are more sensitive to these community vulnerable needs. So that, I think, is an opportunity that we want to be reminded. And also success stories of people with disabilities in savings groups becomes a role model for children and youth with disabilities, can be a great motivation for parents to really see that, okay, my children have future, that they can succeed economically as well. So role models, it's important. We find inclusion in savings groups, financial independence, progress, creates sense of belongingness, dignity, choice and freedoms for people with disabilities, which is very important for them. And in conclusion, some of the key lessons that we are learning or key issues that we are learning. Disability sensitization is a starting point. Access issue is very, very important. Not just infrastructure, but communication methods, access to social services as well. Participation and representation is important. DPOs, disabled people's organizations, may not be always existent in the community, so we need to really support their capacity building as well as establishment as well. Main support needs that are being expressed by people with disabilities we find so far is economic activities and also education, especially savings groups seems to be very popular. There is a big gap in policies and implementation. Very often we find that at national level, policies are there, and in some cases, strategies are even there, but implementation is very weak. So this is an area that we can really work with local government to strengthen. Again, data disaggregation is important, and then use of local resources, including expertise, is important. We are also finding a lot of opportunities to work with local business sectors. It is something that sometimes is overlooked, but business sectors, local business sectors are willing to support these causes. And so there's a huge opportunities. And then getting support from local government, DPOs, I think really strengthen participation in community assessment. And also another thing that I hear from our colleagues working in the field is that when it comes to the most vulnerable issue or participation barriers, each issue is very unique. So sometimes we need to be very flexible. We need to be willing to be taking time and be flexible and just not look at it through project approach, but really be flexible and be patient of how things are going and respect the diversity and uniqueness of the issues that are there in communities. So I believe this is the final of my presentation, and I thank you again for this opportunity. If you have any questions, please feel free to email me. My email address is HITOMI_HONDA@WVI.org. You're most welcome to give me any questions that you may have. I'd be very happy to answer. Again, thank you so much for this opportunity. Bye-bye.